Welcome. My name is Heidi Waldron and I warmly welcome you to today's webinar. I'm a member of AIPPEN Steering Committee along with Megan Anakin, and we are your hosts for today's session. As we begin, on behalf of AIPPEN and ANZAPI, I acknowledge and pay respect to the traditional owners, custodians and knowledge holders of the lands and waters across Australia on which our members live and work, and to their elders past, present and emerging. AIPPEN and ANZAPI acknowledge Māori as tangata whenua and Te Tiriti o Waitangi partners in Aotearoa, New Zealand. I invite you to introduce yourself and make any acknowledgements you feel are appropriate using the chat function of Zoom. So we welcome you warmly to this opportunity to meet colleagues in our conversation-based session that will be kick-started by our guest, Professor Sandra Carr. Today's session is titled Perspective Taking and Engaging in Dialogue, Health Humanities Approaches that are Applicable for Designing and Facilitating Interprofessional Learning. Professor Sandra Carr is Head of Health Professions Education at University of Western Australia. Sandra has over 20 years' experience leading health professions education, faculty-wide curriculum development and mixed methods research. There are many opportunities for interprofessional learning in the postgraduate health professional education courses, and Sandra is currently developing an undergraduate major in Humanities for Health and Medicine. So participants, we encourage you to draw on your experiences to make connections, exchange ideas. We anticipate that you will leave today with at least one new idea to explore and widen your networks of colleagues with interest in interprofessional education. Now, I'm most delighted to hand over to Professor Sandra Carr to lead our discussion today. Thank you, Sandra.
Okay, thanks Heidi and Megan for inviting me to offer this webinar. I do hope that we have lots of conversations, and I'm just going to speak for about 10 minutes to get the ball rolling, to get you thinking about some of the ways in which health humanities can be utilised in interprofessional learning. So health humanities, a little bit of an introduction to what it is. It really gives space to the intersections between the humanities subjects like history and philosophy, sociology, anthropology, and literature and narratives, maybe also visual and performance arts, with health, healthcare, and healthcare practice. So you can see that there is this similarity. We know that if we compare interprofessional learning with health humanities, there are lots of synergies, but there are just some subtle differences that might make it useful, therefore, to consider how bringing in health humanities teaching strategies into the interprofessional classroom can be helpful. So interprofessional learning, we know, focuses on the different professions, learning with, from and about each other. And the health humanities focuses on the intersections between the humanities, healthcare and healthcare practice. From the health professional viewpoint, even though our patient is at the centre, but the focus is that collaborative practice. With health humanities, the way of seeing tends to be very much from the person or the personhood perspective. So with interprofessional learning, it does tend to be the biomedical focus or the biopsychosocial lens. With health humanities, it's much more of a transformational social constructivist lens, if we're considering research. So with interprofessional learning, my experience has been that the common challenges when I've been in classrooms relate to health professional socialisation. So the socialisation of the health professionals into their role, their professional identity. And in the classroom, they tend to stay within that role using the language and philosophy of that role, regardless of whether they're a nurse or a midwife or a physio or a doctor, etc. Even though we have conversations, people tend to have those conversations from within that role. Whereas with health humanities, the focus is on personhood and the relational skills between individuals. So it's encouraging people to leave that professional identity at the door, I suppose, and come into the room just focusing on being a person. So if we look at how health humanities relates to person-centred care, it does utilise the arts and humanities to open up a window of opportunity for patients to tell their stories, but also acts as this vehicle to support our exploration of our own personhood. And I think that's really an important aspect of it. Because, well, what does that mean? Well, what it means to be an individual person. So what values I consider to be important, how I might express my beliefs, how I engage emotionally in my relationships, my dreams, hopes, etc. All of those things contribute to my personhood. So it links, therefore, all of those sort of values and beliefs, the stories that we bring with us, the experiences that we've had, all links with our biases, our attribution errors that we might make in clinical practice about somebody. And that sort of spills over into our behaviours, the way that we provide care as a health professional. So health humanities assists, it's reported, and there is a lot of evidence to say that it assists our expression of empathy and compassion, and assists our capability to appreciate multiple perspectives of others and evidence. So that's teamwork in particular. And also reported to, nurture our own personal growth and resilience and develop skills required for engaging in dialogue, specifically listening, observing and reflecting. But if we think about, well, what is the process that is used for health humanities learning situations, teaching strategies that we use, it is very much based on the transformational learning theory by Mesereau, and it applies that reflective learning theory as originally really described by Dewey in the 1930s. So we use a humanities-aligned prompt. So maybe something from medical history or history itself, or something from literature, so a fictional text or a non-fictional piece of writing or a poem, or it might be an object from an art gallery or a museum. But we use that object as a prompt to present some sort of dilemma, some sort of issue, something that is problematic, and that issue or experience, it could be of healthcare, of illness. So bringing the patient stories as well as the health professional stories to the prompt that then is presented to the students. So we give time, so there always has to be some dilemma to it, I suppose, is the key. And we give time for reflection that always allows for consideration of the person's own perspective, so their own point of view, their own personhood, to understand more about what their values and attitudes and beliefs might be in response to this dilemma. And then dialogue with others. So dialogue is about listening to other people's perspectives, their point of view, but understanding the meaning behind that perspective, where that has actually come from. And then looking for how other people's perspectives may be different to their own, or how it might be informed by research or evidence, or how it might influence your own perspective. So then, after they've listened to other people's points of view and perspective and maybe looked at some of the literature to support that, then there is a reconsidering of their own perspective. And so if you give people sufficient time, and this is a repeated sort of process, then the transformational learning can occur. So you do need about 90 minutes to 2 hours for each of these sort of sessions so that you have a good period of time for people to be reflective of it. So as health professionals, we do, as I said before, we sort of specialise as we become health professionals. The more experienced we are, the more specialised we become. But in health, so we sometimes get quite a narrowed perspective of what it is that we're doing and need to be doing and how we work with our patients. But health humanities is very much focused on broadening out the perspective, being critical of the literature and evidence that's around, but very much broadening out the perspective. So it's looking beyond your own area of specialisation into how other disciplines might interpret that. Professional identity is really sort of left to the side, but it is listening to the perspective of others. And as I've said as well, we just want to go back to the last point on the slide. It's that all of the sessions are focusing on developing the skills required for engaging in dialogue. So truly listening to somebody else's point of view, observing what is happening when we're interacting with people and the way that they respond to situations. So that might include observing a scene, observing a picture, photo elicitation, observing an object, a piece of art. So looking exactly at how the ways in which things are constructed that makes us respond to them emotionally the way that we do as humans. And then reflecting on that and looking at what is our perspective and understanding the meaning behind that perspective. So when I was talking to Heidi, we sort of talked about a couple of examples of what we do with students. So we have lots of examples where we do have an undergraduate major in humanities for health and medicine. That's been running now since 2019, which is really interesting to work with people before they have gone into their medical or dental or pharmacy program. We also work with the MD program here at UWA and have health humanities sessions in years 1 and 3 of the course. And we have our postgraduate courses where we've actually just run a 2-day workshop with some of our postgrad students looking at how teaching strategies, how to bring in health humanities approaches into the classroom with these different types of objects. But one example that we're doing with of this sort of learning strategy that we're doing with undergraduate students that might be of interest to you. Well, there's 2 examples actually. The first one is that the students are put into small groups of 3 or 4, and they are given a book. It's not a non-fictional book. It's called The Diving Bell and the Butterfly. Many of you may know about it. It's about the author is somebody who experienced a stroke and suffered locked-in syndrome. So the students are given sections of the book to undertake close readings of, so paying close attention to the construction of the text and how that provokes some sort of a response from us. And they look at that over a period of time, a week or 2, and then they have several conversations with each other about their response to the chapter or chapters that they've read. And then they come back and they share their discussion about their different perspectives around in the small group and what they took from that. Another example of what we do is that we have students read a book called Extinction by Josephine Wilson, who's a local West Australian person. It's written in WA context. And it's about aging. It's about somebody moving into an aged care facility, but it's a lot of characters in the book from young people, older people. So the students read that book on their own, but they discuss it in class over a period of a few weeks. It's not a very long book, but they identify a character in the book that resonates for them. And they extend the character, they write about that character in a fictional way, and they extend the character, what was interesting about that person from a health point of view, and what do they think the outcome might be around their health that's not necessarily represented in the book. And so you get they have to do some reading around that health topic that the character has, and they do some imaginative, creative thinking about what's not shared in the book, but what is it that I'm interested in about that person and their health experience. So it gets them to do that deeper thinking, that deeper reflective thinking, and it extends the dialogue, I suppose, with the prompt, and through that have a bit more of a conversation around their perspectives and perspective taking. So that's just a couple of examples of what we're doing in the classroom that might be interesting for you. So that's my little introduction of the topic. Hopefully that's helped you to start thinking about health humanities approaches and what might you be able to do in relation to interprofessional learning, so the way in which you might be able to apply that.
Thank you, Sandra. There's so many exciting points, and I can see a number of people writing things down as you're talking. I love many of the themes, and I'll allow people to discuss these in depth in the breakout rooms. So in a moment, thank you, you will all be welcome to join a breakout room to discuss the questions that will be in the chat and that you can see on the screen here about challenges you might face with engaging learners and the shift towards focusing on personhood, and how humanities approaches address these challenges, and to also share some of the experiences or your aspirations of your teaching practice that you could apply here. So welcome back, everyone. Thank you. I really enjoyed our conversation. Often it feels like we're just getting started, but making strong connections with each other, which is very welcome. I invite you to share some insights or ideas, questions that may have been generated from your conversations into the chat. And you can certainly communicate with everyone in the chat. And then I'm going to pass back to Sandra, who's actually been hosting a breakout room, to share some insights from her room and also offer any final comments. I'll pass over to you, Sandra.
Sure. Well, we really just got around the room and introduced ourselves and sort of said where we were coming from and what we might be interested in. So the couple of things that came out of the discussion was how somebody talked about how the differences between the different professions and interprofessional learning, and sometimes the students coming from the different backgrounds, they feel a bit anxious about being in the room with all the students from the different professions. But I think health humanities can be a great leveler because it is focusing on the person and the personhood rather than the profession per se. So it can help students to leave some of that concern behind. They're just bringing their own experiences, not necessarily all about their professional experiences. We also talked about health humanities online and different approaches that we could use to hold sessions that are meaningful in an online sort of setting. And I provided the example of narrative medicine book clubs that can be run virtually as a great example for people to have a consider, especially in the postgraduate arena. And then we had a conversation about how do we maybe bring art therapy into the learning environment. We do have art therapists that come and actually run some sessions for us where the students are creating something. So it really is about the process of creating allows a vehicle for the reflection and the sort of connecting with your own values and beliefs and attitudes and therefore your behaviors. And then through that creation of something, you have a conversation with others. Doesn't have to be particularly artful. We use tearing of tissue paper and then sticking it on with some glue to actually for students to create a bit of a scene. So it's not necessarily that you have to have any artistic skills associated with that. But my final comment sort of relates to the principles of relationship-centered practice. And I think that's really the underpinning aspect of health humanities and how it might work for interprofessional learning, because it really does encourage you to think or to provide respect for the personhood of participants as well as their roles. It acknowledges the role of the affect, or the underlying emotions in relationships and how important they are. So those sorts of things we need to be talking about in interprofessional settings. And it also looks at the context of reciprocal influence. So how I behave influences my other further responses, but also will affect the way in which you receive my communication and respond back to me. And the moral foundation of genuine relationships. So that the principles of relationship-centered practice are being written about by people in relation to interprofessional learning. So that might be something that you want to look a little bit more closely at. There is a chapter in a book called Health Humanities in Postgraduate Medical Education by Alan Peterkin. There's a chapter that's all about promoting collaborative competencies using the arts and humanities to enhance relational practice and teamwork. And the authors of that chapter are Sylvia Langlois and Karen Gold. I can put that detail in the chat.
Wonderful, thank you. Sandra, would you be open to answering a couple of questions if people would like to share their insights? We are a bunch of educators, so we're conscious that people will want to go to their next meeting, so we will finish at 10 minutes to the hour to enable you to walk down the corridor or have a break before your next virtual meeting. But if anyone would like to put their hand up or unmute to ask Sandra some questions. And I've also put a link in the chat to the evaluation survey for you to do at the end of it. So I'd like to open to questions. I know we started some rich discussion in our group about breaking down of silos and also about allowing enough time for this meaningful reflection and listening skills development to occur. Right. I'd like to pick up on the point about the opportunity for creativity. The breadth of different things that can bring creativity into this space. And one of the points that was brought up in my breakout room was about really validating the roles of emotions, that you could allow people to feel, and especially when there was talk about debriefing really complex situations in this kind of learning setting, to allow yourself to be a person, and to move beyond that complication of learning to be supposedly detached, which was highlighted as quite difficult. Sandra, I wonder if you have some comments about that, the bringing of the whole person into that space.
Well, I don't think we can ignore it. I mean, we've got such a big problem around burnout, haven't we, with health professionals? And part of that is that we're trying to shut down part of ourselves with our clinical practice. Of course, you have to maintain your professionalism, but then how do you manage those emotions and feelings and responses after the interaction or once you've done your job? These sorts of learning spaces can really provide us with the support that we need as health professionals as well. And also, understanding the meanings, the reasons why we might respond to one patient in a certain way, but one other person's story in a very different way because of something that might have happened to us or happened to someone that we love or care about. So I think we have to be able to bring our whole self to work as health professionals, and to recognise that everybody else has themselves, they're a whole person as well. And that's part of what makes a team work very well, is that there is this understanding of each other and what actually makes up the whole person. Alice, did you have a question?
Yeah, mine's a bit of an extension of what Heidi was talking about. So I work with post within the workplace, I should say. And I am talking about debriefing complex cases. I know the term icebreaker makes the bile rise in our collective throats, but I'm wondering, is there anything that you go, if we are running a debrief and in that pre-brief context of getting everybody to bring their emotional self, and I'm thinking for us it might be in an environment where we work in public health, but where a case has died or something and we're wanting to debrief, and we do need to debrief in our roles. That's part of it for quality, but also kind of to set up the expectation that it's okay to bring your human selves, yet still get down to business in the hour and a half that you might have.
Yeah. Well, it depends on where you want to put it, I suppose. Whether the personal response needs to be explored, voiced before you can get onto the business. So maybe you need a half an hour to start with. Let's just talk about our responses to this case. That's the prompt, really. How did you respond? What were your thoughts? How did that make you feel? Why do you think you felt like that? Okay, what does someone else feel? How does that connect? How did that affect you in the moment? How did you change your behavior because of that? Before then you can sort of move on to, all right, well, we've actually now more understand how we responded to that situation and how it made us feel. Then it helps us to make sense of it. So now what things do we need to maybe change next time, or how could we have improved our practice? So moving on to the actual action part of the reflection or the transformational learning cycle, I would encourage you to have a look at that Mesereau's theory and see the specific steps in that process, and that might help to give you a bit of guidance.
Wonderful. Thank you. That's a wonderful way to finish this webinar. I would like to say a very big thank you to Sandra Carr. I feel very inspired to take the interprofessional learning to a different level, and also one that acknowledges the personhood of not just the patient, but also the staff providing the care, and just such wonderful ways to break down some of the silos, as well as acknowledging many of the challenges that we face that are often logistic in this space. So I would also like to extend a really big thank you to Megan Anakin, my co-host, who does so much organising behind the scenes to make these happen, and also to Kendall and Jill Romeo from ANZIPPE, who are just stalwart supporting us. Many of you will have been to the recent conference, which was fabulous, and it's wonderful to see you here today. And for those who are new to this space, we welcome you to continue to our future events. There are a number of future events coming up. Yeah, there's one on the 21st of September, how to create a culturally safe environment for students. 19th of October, there's a masterclass, how do I embed empathy and compassion in my learning environment? And then we also have another one, 17th of August, quite soon, how do I balance competing priorities in health professions education? And then we have another webinar for AIPPEN, which is on the 4th of October, same time, same place, and you can register via this link and on the ANZIPPE website. So I say thank you very much for joining us today, and look forward to seeing you at future ANZIPPE and also AIPPEN events.